Now, speaking of Joe Lieberman, will he filibuster the health care bill if there is a public option? Here's his latest.
But I'm afraid that our colleagues in the House added a lot onto that subtract from the genuine purposes of health care reform. And one was to create a public option plan. The public option plan is unnecessary. It has been put forward, I'm convinced, by people who really want the government to take over all of health insurance. They got a right to do that. I think that would be wrong. But worse than that, we have a problem even greater than the health insurance problems, and that is a debt. $12 trillion today projected.
Okay, so here he goes. So we have senators that are threatening filibusters, de facto filibusters, both if there is not a public option and if there is a public option.
That they don't like.
That they don't like. So I don't know what's going to happen with this. I have no idea. I mean, we're getting into mid-November at this point. The target of having something passed and signed by the end of the year, it's starting to seem more and more unlikely. And to be honest, even if it does pass, I'm not convinced that it's going to be any kind of a significant improvement on what we have. I hear those saying this kind of incrementalist view that doing anything, any improvement at all, is worth it. But if for every single tiny improvement we need this number of hours of debate, and we do need the 2,000 pages just for a tiny improvement, then I don't know how long it's going to take to really change the structure of the healthcare system in the U.S. It could be 50 years.
I don't know, but one small step at a time is fine with me. It's better than nothing.
I'm just not convinced of that. I think that if the step is so tiny that we spend a year, it's almost a waste of time. We might as well start from the beginning. We might as well have Barack Obama come out and say, you know what? I'm going to veto any of these bills. I'm proposing that we expand Medicaid and Medicare to cover younger people, to cover people with higher incomes. Let's test it. If it works, let's keep going and extending it until we have a single payer plan. It would almost be worth just doing that if the improvements are going to be so tiny as to barely be worth anything. I mean, we've already talked about the fact that in a compromise, everybody should end up unhappy. What are the insurance companies unhappy about? The insurance companies, I don't see, have compromised anything. They've gotten everything they wanted, and to me, that's concerning.
Right. I think if the current bill passes the way it is now, the insurance companies would be fine with that, and I think they had a lot of influence.
Well, Tom Tancredo walked off the set of the Ed Schultz TV show after Markos Moulitsas of Daily Kos called him out as a chicken hawk, and he also called him out for skipping out on the war in Vietnam after saying he supported it, but then saying he couldn't go because he was being treated for depression. And Tom Tancredo literally just walked off the set. Take a listen to this.
Medicare has already got lots and lots of problems, and I do think it's a problem. Absolutely. You can't keep doctors
so how about
in
the
it because
Veterans
they keep
Administration? The Veterans Administration is a single-payer system.
Same
Everybody
thing.
in the military who was treated yesterday. So the military members, their healthcare system, that's also a threat to our freedom.
Talk to every veterans group I ever went and talked to complained about the Veterans Administration and the way it was a bureaucratically run program that didn't serve their needs. They would much rather have vouchers that would allow them to go out and buy their insurance in a private marketplace. They've talked about it. At least you're laughing.
What
you may, but talk to the veterans. They talked to me, and that's what they said.
Marcos?
So I'm telling you, there is no government-owned...
Tom, I'm a veteran, okay? I did not get a deferment because I was too depressed to fight in a war that I supported in Vietnam. I'm a veteran, Tom.
Yeah, well, that's
and
what
that's
people
want. They want a more effective. They want a more effective VA.
You cannot.
That's
no,
more
listen,
money.
No, you're not going to. You're not going to do that. You're not going to try to insult me that way and then pretend like we're just going on and talk about that. You either apologize.
I'm not pretending
or I'm
anything. I told you straight up. The issue here is what the Republicans are afraid of. This is a threat to Republicans. They built an entire...
Okay, now Tom Tancredo is walking off. It's kind of funny. It is kind of I don't know if it is a low blow or not. I love it. I mean, it is true that after graduating from the University of Northern Colorado in 1969, Tom Tancredo became eligible to serve in Vietnam. And for years, he had been speaking out in favor of the war in Vietnam. And then Tancredo said he went for his physical. He told doctors he had been treated for depression and he shouldn't be going. And he did get what's called a 1Y deferment. Bringing it up there, I don't know. Is it a cheap shot? I think it's funny.
I think it's funny. I mean, that's the only it's the only person who could say something like that
Because
he-
Marcos is himself a veteran
because
as
he
well.
supported Vietnam and he went over there.
Oh, who? Well, no. Hold on a second. Marcos didn't.
Marcos went over there but didn't support it.
No. Tom Tancredo supported it, didn't go over there. Marcos is much younger. He wasn't involved
No,
in any
just
way.
a veteran in general.
He's a veteran, right?
Right.
In that sense, he is a guy who can criticize Tom Tancredo, but saying that, I don't know.
I suppose.
It's a bit of a low blow, but I love to see controversy anyway.
Well, it's good entertainment.
Well, more bad news related to healthcare from Harvard Medical School. It turns out that an estimated 2,266 veterans under the age of 65 died last year because they did not have health insurance. And we hear conservatives over and over continue to repeat that nobody actually dies from lack of health care. Well, this Harvard Medical School study says that, in fact, they do. Doing the math, this is about 6 preventable deaths every single day. It's also more than twice the number killed in Afghanistan since the war began 8 years ago in 2001. So evidence mounting against those who say nobody is actually dying in the U.S. from lack of health care. And we see a new study almost every week that says, in fact, people are dying from not having health care.
We do know that there's a lot of homeless veterans, though. I'm sure a lot of these numbers, might be from that category. Too.
Well, but they could be homeless, but presumably they should still have access to health care, should they not?
Some form of health care, yes.
Okay. 75% of young Americans are just unfit for military duty. So we have military veterans who are dying from lack of health care, and we have a situation in the U.S. where 3 out of 4 young Americans, potential military recruits, are simply unfit for duty for health reasons. The latest Army statistics show that a stunning 3 out of 4 military-age youth, and what is military age? Would that be 17 to 26? I mean, what age range do you think is there?
Really not sure. I imagine, end of high school-ish age to bracket. I don't know how
into the
far that
20s.
goes.
Yeah, I don't know how far it goes. Are ineligible to join the military because they're overweight. They can't pass the entrance exams. And I can assure you, those entrance exams are not the toughest exams. I mean, we're not talking about passing the bar after getting your law degree. We're talking about a military entrance exam. The bar is not, I don't think I'm surprising anybody by saying the bar is not particularly high there. And many have dropped out of high school or had run-ins with the law, which also will disqualify you. 3 out of 4. And okay, here I have the information. Between 17 and 24, which are the prime recruiting ages, they just can't even meet these minimum standards that retired military leaders are calling for more investment as a result. It's amazing to me that out of 4 randomly picked 17 to 24-year-olds, 3 are just unfit to enter the military, in part because they can't pass their entrance exams, in part because they're overweight, and in part because they have some kind of a record or not even a high school diploma.
It's a huge number.
In thinking about it, it's of course very heavily
What do you
skewed.
do? Lower the requirements,
They've done it before.
Right.
I mean, when the Iraq War wasn't going well, the requirements were changed. I think they increased the maximum age to enlist. Mm-hmm. There were other changes made, and I even think that this test might have been made easier. I mean, how easy can the test get?
I don't know.
I'd be curious, out of those 3 out of 4, how many are not passing the test and how many are overweight. I don't know. Not good. Not a good sign, especially with a disillusioned group of young people who, in many cases, opposes these wars. If 3 out of 4 aren't even eligible or unfit to join, there's going to be military recruiting problems. I think it's clear to say.
There must be already.